Hi, I'm Hannah Greenwood from the Institute for Evidence-Based Healthcare at Bond University in Australia. I'm here with my colleague and senior author, Dr. Loai Albarqouni, to share some exciting insights from our recent study published in the Annals of Internal Medicine. We looked into the long-term effects of salt substitution for cardiovascular outcomes.
We often hear that reducing sodium intake can improve our cardiovascular health. But cutting back on salt can be tough, especially when adding salt during food preparation or at the dinner table is deeply ingrained for many people. But what if there was a way to reduce sodium intake without asking people to break the habit of adding salt to their food?
Salt substitutes swap out some of the sodium chloride in regular salt for potassium chloride, offering a way to dial down sodium intake without sacrificing taste. This matters because excessive sodium intake is a major driver of high blood pressure and cardiovascular disease.
When we heard of this promising strategy to reduce sodium intake, we were curious about the long-term impact on cardiovascular outcomes and any potential harmful side effects. So we conducted a systematic review of randomized controlled trials with at least 6-month follow-up.
Across 16 trials of over 35,000 participants, we found uncertain but clinically meaningful mortality and major cardiovascular event risk reductions. This was without increased risk of serious harms, though it's important to note that certainty of this evidence was very low. We're talking about a possible 12% reduction in all-cause mortality risk, that is, deaths from any cause, and a 17% reduction in cardiovascular mortality risk, that is, deaths from cardiovascular disease. But here's the catch. The certainty of evidence for these findings is low, meaning we're uncertain of this effect for Western populations or younger people in general good health. This is because most of the studies we looked at were conducted in China and Taiwan, or amongst people who already had a higher than average cardiovascular risk, such as people who are older or have hypertension.
So, what does this mean for Western populations? Well, it's not as straightforward as you might think. In places like North America, Europe, or Australia, where processed and takeaway foods drive salt consumption, implementing salt substitution strategies might require a different approach, maybe even at the policy level. We also don't know much about the benefit of salt substitutes for people with low risk of cardiovascular disease.
Here's the bottom line. Salt substitutes could be a game changer in our fight against cardiovascular disease. Sure, there are challenges to overcome, and more research is needed, especially in Western and healthy populations. But as a cost-effective and scalable intervention, salt substitutes offer a promising avenue for reducing cardiovascular disease events and deaths.